Now it's that time for us to kickstart our conversation on Sunday Express tonight. We focus on mental health, something that has really, formed a debate in the country, especially looking at the numbers that are rising each and every day. Kenyans facing different forms of mental health issues. We are seeing on our reports being reported across the media, people are killing each other, intimate partner violence. We see people engaging in drug and substance abuse. These are just expressions of what is happening in the society and what needs to be done. And I want us to talk about the mental health crisis in the country. We look at the numbers and what we've been able to do as a country concerning this crisis. And I'll be engaging Dr. Alfred. Gitonga is already in studio with me. Thank you so much, Daktari, for creating time for us tonight.
Thank you very much for having me.
All right. Daktari is a mental health advocate, but he also works in the Division of Mental Health under the Ministry of Health. And once again, we appreciate you creating time for us tonight. I just want us to begin by painting the picture of how bad this problem is in our country. Just recently, in the wake of the COVID-19 pandemic, experts were concerned about how the pandemic actually led to, the surge in numbers that were already high before the pandemic. Kindly just tell us, as we speak today, what is the status of mental health in our country?
Okay, thank you very much for that question, Serfine. We have figures that we'd prompted before on the numbers of patients that experience mental health conditions. And in the hospitals, we have 25% of outpatients and 40% of inpatients expressing mental health conditions. Mm-hmm. Further to that, it has been proposed that 1% of the population of Kenya suffers from psychosis. Mm-hmm. That would amount to probably around 5 million individuals. And that is a very big number.
5 million?
Yes, 5 million individuals, if we go by the percentage that has been proposed by the studies. Mm-hmm. And according to the Global Health Observatory study by the World Health Organization, we have 10% prevalence of common mental health conditions in this republic. Mm-hmm.
When you say common mental health conditions, yes, how common are they, and which are these conditions that you're talking about?
Okay, the conditions that have been touted as the common mental health conditions in Kenya are depression, substance use disorder, and anxiety disorders. Mm-hmm, mm-hmm. Those are what the population suffer from the most.
I'm looking at, those grim statistics, and one thing that stands out for me is the fact that you've said these are conditions that have been diagnosed, and, these are things that at least they've been reported at the hospital level. Talk to us about the lack of diagnosis. There could be many Kenyans who could be going through some form of mental health condition, and they do not even have an idea. Maybe you can talk to us about the lack of diagnosis and how this is also affecting the efforts to address this particular crisis.
Okay, we have persons that are known to be suffering silently in their homes, mm-hmm, because they are afraid of accessing mental health services because of the stigma associated with mental health. Part of the reason is because we have cultural leanings that mental health was touted as something that nobody wanted to talk about because the family would get stigmatized in the community. And most of the people in the communities do not front the people who have mental health conditions to the hospitals for treatment, and they are suffering in silence in the villages, and we'd like them to come to the hospitals to seek care.
Mm-hmm. All right. Let's talk about what is leading to the surge in these numbers. These are not good numbers, if you may ask me. The COVID-19 was cited as one of the things that probably led to a sharp rise in the numbers of mental health disorders in our country. Could there be any other contributing factors that, from your perspective, would actually justify the surge in numbers?
Yes, please. Mm-hmm. So we have what we call the social determinants of mental health. And these are the factors that precipitate the occurrence of a mental disorder in an individual. And what I can mention for you right now are 6 factors, and leading amongst them is poverty. We know that a third of the Kenyan population live below the poverty line, and this predisposes them to developing conditions such as depression. Second is unemployment. Youth unemployment in this country stands at around 40%, and these unemployed youth are not able to access, provide for themselves, and this has been leading to distress and also precipitates the occurrence of mental disorders. Then we have what we call the disasters that happen from time to time within different regions of the country. What is most known are weather-based disasters, such as droughts, famine, and floods. People lose property in these conditions, and also that predisposes them to stress and the development of mental health conditions. Okay, we have things like substance use. Substance use has been known to precipitate mental health conditions. We have things like the youth participating in activities like gambling. Gambling in its own is a risk factor for developing mental health conditions. And those are some of the key determinants that cause people to develop mental health conditions. Yes.
The question that many people usually ask when, for instance, we receive reports of couples who've killed each other, maybe somebody has burnt the whole family in the house, is always why would somebody turn against their loved ones to that particular extent? As a psychiatrist, probably, just to take us through the mind of somebody who is a victim of a mental health disorder of some sort, what usually happens for a human being to get to that particular point?
Okay. Mental health conditions, by their very nature, have predisposing factors.
Yeah.
And high among them is genetic predisposition, which you inherit from the genes that you get from your parents. And if you are predisposed, it affects the way your mind processes thought, emotions, and that is seen evidently by people, as you express it externally, as disturbed behavior. So that is usually the source of mental health conditions.
There's a lot that the government has done, especially it escalated during the COVID-19 pandemic when the head of state appointed a mental health task force that is chaired by Dr. Frank Jenga that was supposed to address this particular crisis. And I know also the Ministry of Health has undertaken quite a number of strategies to curb this particular crisis. Maybe you can take us through that and what has worked and what is left that we need to do as a country to mitigate this crisis.
Okay, thank you for that. So the Ministry of Health has been developing policy papers to try and mitigate the rising prevalence of mental health conditions in the country. And I will attempt to go through a few of the documents that the ministry has been developing. As I also mentioned, those that are under construction. So first amongst those is the Kenya Mental Health Policy, 2015 to 2030. This document sets the way forward for how the country will handle mental health conditions and discharge treatment and prevention activities in the foregoing years. And this policy led to the development of the Mental Health Action Plan. The Mental Health Action Plan is a 5-year strategic plan that operationalizes the key priority actions that have been set out in the policy. And as you have mentioned, there was a mental health task force that was inaugurated by His Excellency the President in the year 2019. And it was during his Madaraka Day speech that he decried the high prevalence of mental health conditions in the Republic and directed the Ministry of Health together with other line ministries to come together and find solutions so that the public can stop suffering. And he quoted depression as causing a lot of turmoil and distress to the public, as has been seen by some of the things that people do. We have seen cases of suicides, homicides, femicides, and other forms of mental disturbance expressed externally by the public. So the Task Force on Mental Health came up with this document called the Mental Health Task Force Report after a series of memoranda reception and going around the nation collecting the views of the public, and came up with recommendations that would be used to, from then on to reduce the incidence and prevalence of mental health conditions in the country.
So just to take us through maybe 3 key recommendations, because we're trying to find a way, a solution. What is it that we need to do to seal this gap once and for all? What is it that the task force recommended?
Okay, one of the recommendations was the formation of a National Wellness and Happiness Commission that will be undertaking the National Mental Health Survey in the Republic and reporting on the happiness levels of the public. Number 2 was that they recommended that every 5 years, that we have a review of the current situation of the policy documents, that we do a new action plan every 5 years after review. Those are two of the key recommendations. And there are many other rafts of measures that have been recommended by the task force that are being implemented as we speak.
When we see reports such as the examples I cited earlier, one would be tempted to ask, are these just beautiful policies on paper that are lying somewhere at the Ministry of Health? How come the impact is not felt on the ground? The numbers are not going down. What is the problem? What are the gaps that probably are there?
Okay, how I would approach that is by saying that evidence of policy will only accrue after a few years of implementation. But let me mention one before we proceed, which is the National Telemental Health Guidelines, that this has led to the construction of a telemental health center at the Medari National Teaching and Referral Hospital that will be offering telemental health services to the public. And this is one of the key measures that we'll see us handle a lot of the incidences of mental health in the Republic.
So as we wait for the few years for this, you know, the results of these policies and these strategic plans to come to reality, we are losing people, Daktari, and Kenyans are worried because of the numbers of our loved ones that we are losing to suicide, for example, and those who are killed in homicides. What do we do between now and then as we wait for the practicality of these documents?
Okay, what I can say is what the government is trying to do for the people. And as you know, the Constitution of Kenya sets aside the roles and responsibilities of the national government and those of the county government. So the national government, in meeting the high prevalence rate, has also trained mental health and psychosocial support teams in all the 47 counties with a mental health focal person. And those psychosocial teams have been trained in offering psychological first aid and basic counseling services. And now these services are available at the local level in all the counties. Further to that, under the UHC, there are psychologists who have been deployed to all the counties on a 3-year contract to provide an enhanced package of services for people in the counties. We also have community health volunteers that have been trained. So far, in the counties of Mombasa, Kitui, and Nakuru, 30 community health volunteers per county have been trained to offer services to the people in those regions. So the government is expanding access, and we also have the National Health Insurance Fund, which is offering medical cover so that people can now be able to access mental health without suffering financial difficulties.
All right. Thank you so much, Daktari, for creating time for us. As we come to a close on this conversation, I want you to look at this camera and just talk to that person who's watching you. What is their role as an individual in terms of taking care of their own mental health?
Okay, I'd like to tell the people of Kenya to take initiative, that your health is your responsibility. As it stands, the uptake of the NHIF cover by the general public is only at 16%, despite a lot of media campaigns advocating for people to get some insurance coverage so that it can protect you from adverse exposure should you need to access mental health services. Kindly take initiative for your own health. Number 2, a problem solved, a problem shared is a problem half solved. I would like to encourage people to share their problems so that you do not suffer in silence, and that will lead to a reduction in distress and probably get you to another day, because problems do not last forever. Please take initiative for your own health. Thank you.
Thank you so much, Daktari. Take initiative for your own health. That's your parting shot there. Dr. Alfred Gitonga is a mental health advocate, a consultant psychiatrist, working at the Division of Mental Health under the Ministry of Health, talking to us about the status of mental health in the country. And that is how we wrap it up right here on Sunday Express. Thank you for creating time to watch us tonight. My name is Serfine Achieng. Of course, I've not been doing this alone. On the other side of the studio, we have John Jacob Kiria. Kiria, it's now over to you. Thank you so much for watching once again tonight.